Bismillahirrahmanirrahim. Assalamu alaikum. This is Hasina Ali. I welcome you all in class 9th biology. Dear students, today we are going to discuss transport in animals. SLO number 9.4.4 and 9.4.5. Determine the risk of incompatibility in blood transfusion due to antigen-antibody reaction. Second, state appropriate donor and recipient for each of 4 blood groups. Objectives of these lessons are: define agglutination, describe risks for incompatibility in blood transfusion, determine antigen-antibody reaction during blood transfusion, describe appropriate blood group for 4 different blood groups. Dear students, before going to start our lesson, there are some important terms to know, that is agglutination, incompatibility, blood transfusion, donor, recipient, antigen, antibody. Let's define agglutination or clumping. Agglutination is a process that occurs if an antigen is mixed with its corresponding antibody, called isoagglutinin. This term is commonly used in blood grouping. This occurs in red blood cells in the presence of an antibody. So, clumping of red blood cells due to antigen-antibody bind to the surface of red blood cells. As a result, red blood cells make aggregates or clumps called agglutination. Antibodies are called agglutinin because they cause agglutination. So, clumping of red blood cell is called agglutination, and it is caused by antibodies which are present in a plasma. Dear students, let's have a look on ABO blood groups. ABO blood groups are named after the antigen present on the surface of red blood cell. People produce plasma antibodies against the antigen that are not present on their own red cell. Group O individual therefore have in their plasma antibodies to both A and B, while group AB individuals have neither of these antibodies. So dear student, in this diagram there is a presence of antigen on the surface of red blood cell. So if we consider red blood cell, the red blood cells contain some antigen on the base of which the blood group is determined. For example, in blood group A, there is antigen A is present, whereas in plasma, antibody B is present. Whereas in group B, the antigen B is present on the surface of red blood cell, and anti-A antibody is present in the plasma. And if we consider group AB, both antigen A and B are present, and there is no antibodies in their plasma. Whereas in blood group O, there is no antigen A and antigen B on the surface, whereas they contain both the antibodies on the surface plasma. Let's discuss what is meant by blood transfusion. Blood transfusion is the transfusion of whole blood or its components such as blood cells or plasma from one person to another person. Blood transfusion involves 2 procedures, that is collection of blood from the donor and administration of blood into the recipient. So what is the purpose of transfusion or blood transfusion? Blood is transferred from donor to recipient to restore the blood volume when there is sudden loss of blood due to hemorrhage, to raise the HB level in cases of severe anemia, to treat deficiencies of plasma protein, clotting factor, to provide antibodies who are sick and having lower immunity. Blood grouping and cross matching. Each person has one of the following blood type: A, B, AB or O. O can be given to anyone but can only receive O blood group. AB blood group can receive any type but can only be given to AB. Also, every person blood is either Rh positive or Rh negative. So, the blood used in a transfusion must be compatible with a patient's blood type. Type O blood is called universal donor. People with blood group AB blood are called universal recipient. People with Rh positive blood can get Rh positive or Rh negative blood, but people with Rh negative should get only negative blood. Blood transfusion in ABO blood group system. Blood transfusion is the process of transferring blood or blood-based product from one person into another circulatory system. It can be life-saving in some situations such as massive blood loss due to injury, or can be used to replace blood loss during surgery. People suffering from anemia, hemophilia, thalassemia or sickle cell anemia may require frequent blood transfusion. Transfusion of blood is done after confirming that no agglutination results in the blood of recipient. If agglutination occurs, the clumped cell cannot pass through the capillaries. For confirmation of no agglutination, blood samples of donor and recipient are cross-matched for compatibility. Antibodies of recipient's blood may destroy the corresponding antigen containing RBCs of donor, or antibodies of donor blood may destroy antigen containing RBC of recipient. So this chart shows compatibility in ABO blood group system. That is, so this chart shows that O blood group is accepted by every blood group including A, B and O. So that's why O is universal donor, whereas group AB can receive all type of blood including O, A, B and AB. That's why it is called universal recipient. O blood group individuals are called universal donor because they can donate blood to the recipient of every other blood group. AB blood group individuals are called universal recipient because they can receive transfusion from the donor of every other blood groups. So while doing blood transfusion, it is very important to check Rh factor, either Rh positive or negative. So blood transfusion in Rh blood group. Rh positive can be transferred to Rh positive recipient because recipient blood already has Rh antigens and will not produce anti-Rh antibodies. Rh negative blood group can be transferred to Rh negative because donor blood does not have Rh antigen, and so recipient blood will not produce anti-Rh antibodies. If an Rh negative person receives Rh positive blood, he or she will produce anti-Rh antibodies against Rh factor. Rh negative blood can be transferred to Rh positive recipient only if donor blood Rh negative has never been exposed to Rh antigens and does not contain any anti-Rh antibody. So dear students, this chart shows compatibility in ABO and Rh blood group system. So with the help of this chart, we can see that O negative blood can be received by every other blood group. For example, O can be received by O negative can be received by O positive, O negative can be received by A positive and A negative, as well as B positive, B negative, AB positive and AB negative. So, this shows that O negative is considered to be a universal donor. Whereas, if we consider AB blood group is known as universal recipient because it can receive all kind of blood including O, A, B. This is because AB blood group do not contain any antibody in their plasma. Dear students, for further clarification of a topic, let's watch and listen a video.
Alright, today we're going to talk about blood compatibility. There are most definitely going to be NCLEX questions where you are asked if there is a person with this type of blood, can they receive blood from this person or vice versa? So let's go over the types of compatibility. First and foremost, there is ABO compatibility. This is the most serious one. It's the one you're going to want to be most familiar with. Essentially, we have three different types of antigens that can be present on the surface of your red blood cell, A or B, or the combination of A and B. This makes for four different blood types. You can have AB blood with both A and B antigens, A blood with only A, B blood with only B, or O blood with no antigens at all. These antigens mark the surface of the red blood cell as your own, so the body knows not to attack it. It's not a foreign substance. When your body has those antigens, it will make antibodies against any antigen it doesn't have. This is how your body protects itself. If you have type A blood with A antigens, your body is going to produce B antibodies to attack any blood cell with a B antigen. This is your body's way of marking it as foreign and saying, hey, you don't belong here, and it wants to destroy it to protect you. So we'll go through our four blood types. With AB blood, you have both A and B antigens, and this means you have no antibodies. Your body already has all the antigens, so there's nothing to mark as foreign and your body wants to fight against. This means that you can, if you have AB blood, you can only donate to another person with AB blood. But you can receive blood from anybody. That's because your body is not making any antibodies, so any type of blood, AB, or O, would be safe for this person to receive. They would not mark it as foreign because they don't have any antibodies against it. For type A blood, you will only have A antigens, therefore you will create B antibodies, and you can give blood to those who are type A or type AB. You can receive blood from type A blood or type O blood. Each blood type is always going to be able to receive blood from their own blood type, that's the ideal situation, or from blood type O, that's going to be our universal donor, and we'll get to that here in a second. For type B blood, it's just the opposite of A. They have only B antigens, therefore they create A antibodies They can give blood to blood type B or blood type AB, and they can receive blood from blood type O or blood type B. And last but not least, we have our blood type O, our universal donor. This is a naked red blood cell. It doesn't have any antigens on its surface. Therefore, anything else that you are giving to that person would be marked as foreign by the body. If you give them type A blood, those A antigens are going to be marked as foreign. If you give them type B blood, those B antigens are going to be marked as foreign. So they can only receive blood from blood type O, but they can donate to any blood type. ABO incompatibilities are the most serious. They are frequently fatal, and hospitals do a lot of work to make sure we are not giving incorrect blood types to our patients. All right, we've got ABO compatibility. The next part of compatibility for blood questions on the NCLEX is RH compatibility. This is super straightforward. It won't take more than a minute. You can either be positive or negative for the RH factor. Quite simple. If you're positive, you've got the RH factor. If you're negative, you do not. Similarly, with the antigen situation in ABO compatibility, if you have the RH factor, you can either receive blood from positive or negative blood types. This is because your body already has that factor. It's not marked as foreign. It is in your body already. But if you have RH negative blood and you received a blood type that was positive and had those RH factors, your body would mark it as foreign. It would not recognize it and it would attack those blood cells. So if you're positive for the RH factor, you can receive blood from either positive or negative donors. But if you are negative for the RH factor, you can only receive blood from negative donors. Putting this all together in one picture, what your question will likely look on the NCLEX is something along the lines of, you have a patient with B positive blood. Which of the following are acceptable blood types for transfusion for your patient? And you'll have a list of 4 different blood types. It'll be select all that apply. So for B positive blood, you're going to go through the list and say, okay, they have B antigens, they are positive for the RH factor. That means they're producing antibodies against A. So they cannot get A, they cannot get AB. Anything with an A in it, you can just cross that out in any of your choices. They can receive their own blood type, obviously, so B, and the universal donor, O. You also know they're positive, so either positive or negative blood is okay for this recipient. Remember, if they're negative for the RH factor, they will need to receive negative blood. Most hospitals have a large supply of O negative blood because that is universally acceptable for blood transfusions in all patients. All right, that's everything you need to know to ace your questions on blood compatibility.
Hope you have enjoyed the video. Now I am going to ask few questions from you. Hope you are ready. Choose the correct answer. 1. The blood group which is called universal recipient is A, B, AB and O. Question number 2. Blood group which is called universal donor is A, B, AB and O. A man rushed to casualty, nearly dying after a massive blood loss in an accident. There is not much time to match blood group. So, the physician decides to order for one of the following blood group. Should the physician decide? A, O negative, B, O positive, C, AB positive, D, AB negative. 4. AB positive blood group is universal recipient because of A, antigen A and antigen B both are present. B, no antigen is present. C, No antibody present in plasma. D. Antigen A is present but antigen B is not. Task 2. Dear students, make a compatibility chart for blood transfusion for ABO blood group system and RH blood group system. Dear students, hope you have enjoyed the lesson. Thank you for listening and watching. Take a good care of yourself. Goodbye.